This was in a presentation for Health Point community and is being recorded for YouTube presentation. Mounjaro comes in different doses, the main one 5, 10 and 15, and there are more doses along with NDC that we will discuss. So the starting dose for Mounjaro is 2.5 milligram once weekly. That's for 4 weeks. Then you can go to 5 milligram once weekly for another 4 weeks. The higher dose is 7.5 milligram once weekly for 4 weeks, then 10 milligram once weekly for 4 weeks, and 12.5 milligram for another 4 weeks, and eventually the highest dose is 15 milligram once daily. Mechanism of action and effect of Mounjaro. Mounjaro is a single peptide that activates GIP and GLP-1 receptors that increases insulin secretion from pancreatic beta cells, increases insulin sensitivity, reduces glucagon levels, and slows gastric emptying. Indication for Mounjaro is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. Limitation of use is indicated has not been studied in patients with a history of pancreatitis. Mounjaro is not indicated for use in patients with type 1 diabetes. So those are important notes. Storage and handling. Store Mounjaro in a refrigerator at 2 degrees to 8 degrees centigrade, which is 36 to 46 degrees of Fahrenheit. If needed, each single dose pen can be stored unrefrigerated at temperature not to exceed 30 degrees centigrade or 86 degrees Fahrenheit for up to 21 days. Do not freeze Mounjaro. Do not use Mounjaro if frozen, and store Mounjaro in the original carton to protect from light. So these are the different NDCs that pharmacies can order for each dose of Mounjaro. Adverse effects: risk of thyroid C-cell tumors, hypoglycemia with concomitant use of insulin secretagogue or insulin and also glipizide. Pancreatitis is another side effect. Diabetic retinopathy complication. Inform patient to contact their healthcare provider if changes in vision are experienced during treatment with Mounjaro. Regarding acute kidney injury, advise patients treated with Mounjaro of the potential risk of dehydration due to gastrointestinal adverse reaction and take precautions to avoid fluid depletion. Advise patient to read the FDA-approved patient labeling, medication guide, and instruction for use. In terms of pregnancy, available data with Mounjaro use in pregnant women are insufficient to evaluate for drug-related risk of major birth defect, miscarriage, or other adverse maternal or fetal outcome. There are risks to the mother and fetus associated with poorly controlled diabetes in pregnancy. So there are some risk of birth defect, 6 to 10% in women with pre-gestational diabetes with A1C of greater than 7%. It has been reported to be as high as 20 to 25% in women with A1C of greater than 10%. The estimated background risk of miscarriage for the indicated population is unknown. In the U.S. general population, the estimated background risk of major birth defect and miscarriage in clinically recognized pregnancies is 2 to 4% and 15 to 20% respectively. Also, use of Mounjaro may reduce the efficacy of other hormonal contraceptives. Advise patients using oral hormonal contraceptives to switch to a non-oral contraceptive